Hi friends, welcome to my channel Medbee. Today I am going to talk about high blood pressure. It's also known as hypertension. It's a very common condition in elderly people. Hypertension rarely has noticeable symptoms, but if untreated, it increases your risk of serious problems such as heart attack, stroke, eye problems, kidney problems, and many others. Before going to know about hypertension, we have to know what is blood pressure. Blood pressure is the pressure of circulating blood on the walls of blood vessels. That is, it's a pressure exerted on the walls of large arteries. Hypertension means the pressure exerted on the wall of arteries if high enough. That is, elevated blood pressure. If you have hypertension and you still feel fine, that is because hypertension usually doesn't cause any signs of illness that we can see or feel. The only way to know whether you have hypertension is to check blood pressure. We can check blood pressure in our nearby hospital or in any pharmacies or any health centers, or we can check it by ourselves with a home blood pressure monitors. When we measure our blood pressure, the result is given in two pressures. The first one is systolic blood pressure and another is diastolic blood pressure. Systolic blood pressure is the pressure caused by our heart contracts and pushing out blood. And the diastolic blood pressure is the pressure when our heart relaxes and fills with blood. The normal value of systolic blood pressure is less than 120 and the diastolic blood pressure is less than 80. So it's usually expressed in terms of systolic blood pressure over diastolic blood pressure. The normal value of blood pressure is less than 120 over 80. Moving on to the next topic is stages of hypertension. It includes pre-hypertension, stage 1 hypertension and stage 2 hypertension. The normal blood pressure is less than 120/80. If the blood pressure stays between 120/80 to 139/89, that is, systolic is between 120 to 139 and the diastolic is between 80 to 89. It's called pre-hypertension. But we can't diagnose as a hypertension and consider it as pre-hypertension. Means it's not a high blood pressure but mostly likely to develop in the future. The next is stage 1 hypertension. It's a mild hypertension. If the systolic blood pressure